Intro. Millions of Americans are at risk of losing healthcare due to Trump's newly signed bill. With major cuts to Medicaid and changes to ACA coverage, the impact will be wide and long-lasting. Many families may no longer qualify for affordable insurance. This video breaks down who is affected and what it means for them. If you or someone you know relies on government-assisted healthcare, this information could be critical. We also explore the ripple effects, especially in small towns and rural communities. Please note, the information shared in this video is based on publicly available sources and general analysis, and outcomes may vary depending on individual circumstances, timing, and future policy changes. This content is provided for informational purposes only and does not constitute legal or medical advice. 1. Medicaid cuts, who's hit first? The biggest target of this bill is Medicaid, with over $1 trillion in cuts planned over the next decade. These cuts mean fewer services and stricter qualifications for millions of Americans. Low-income adults without children are among the first and hardest hit. Seniors who rely on home care funded by Medicaid may lose vital support. In states that expanded Medicaid, millions could lose coverage as budgets shrink and eligibility tightens. These cuts don't just remove funding, they reduce access to life-saving care that many depend on. For many Americans, especially the working poor, the consequences will be devastating and long-lasting. 2. Work requirements for coverage. The new bill requires many Medicaid recipients to prove they are working or engaged in job training. While this might sound straightforward, for millions with chronic illness, disabilities, unstable jobs, or caregiving responsibilities, meeting these requirements can be very difficult. If people fail to meet the work criteria, they could be dropped from coverage, regardless of their health needs. Even those willing to work may find the paperwork and reporting burdensome and confusing. Experts estimate that around 6 million Americans could be affected by these work requirements. This policy shifts healthcare from being a basic right to a conditional reward, creating new barriers. Many vulnerable individuals could fall through the cracks and lose critical access to care. 3. ACA changes, marketplace coverage in jeopardy. The Affordable Care Act is also facing significant changes under this bill. Subsidies that help families afford coverage through the marketplace are being reduced or eliminated. This means higher premiums and out-of-pocket costs for many families trying to stay insured. Additionally, tighter income checks and shorter enrollment windows will make it harder for people to sign up or maintain coverage. Experts estimate that between 3 to 4 million people could lose their marketplace insurance plans as a result. For those who rely on ACA plans, this creates a more uncertain and unstable future. These changes could increase the number of uninsured Americans at a time when healthcare access is already challenging. 4. Rural areas lose most. Rural America is expected to suffer the most from these healthcare changes. Many small hospitals and clinics rely heavily on Medicaid funding to stay open. With cuts to this funding, closures and reduced services are likely, leaving residents with fewer local options for care. For many, this means longer travel times for routine and emergency treatment, sometimes with no alternatives nearby. Emergency rooms in some towns could disappear altogether, increasing risks in critical situations. Additionally, doctors and specialists may leave rural areas due to shrinking funding and job opportunities. For millions living outside cities, this bill doesn't just limit access to care, it threatens to erase it entirely. 5. What this means for you. If you're uninsured or rely on government assistance, this bill will likely impact your healthcare access and affordability. Costs for treatments, medications, and doctor visits could rise significantly. Many people may delay or skip routine care due to higher expenses, leading to worsening health conditions. The risk of falling into medical debt will increase, especially for those living paycheck to paycheck. Even those with current insurance may experience reduced benefits or increased premiums. The bill's effects will ripple across communities, affecting families and individuals nationwide. It's important to stay informed, plan ahead, and explore alternatives wherever possible. Outro. Trump's healthcare bill is now law, and millions will feel its effects in the coming years. This isn't just about numbers or politics, It's about real lives, access to care, and financial stability for millions of Americans. Whether you rely on Medicaid, ACA plans, or simply care about healthcare access, this is a critical moment to understand what's happening. Stay informed, share this video to help others grasp the seriousness of these changes, and subscribe for more updates. We'll also explore solutions, including affordable global healthcare options for those seeking alternatives. Together, we can navigate these challenging times and find better paths forward.